full 500. All right, let's go ahead and get started. Welcome back to Zooming Through Summer, everyone. Today we have Dr. C, and she is an internal medicine MD, and she will be talking a little bit about her journey and the importance of internal medicine. Again, can you, if like to everyone that's just joining, please mute yourselves so it's not distracting. And if you guys have any questions as we're going along, there's a public chat. So if you could just type your questions in there, and then during the Q&A portion of the call, we will try to address as many of them as we can. But please understand that we can't get to all of them due to time limits. And we do ask that everyone keep the questions in the chat relevant to everything that's going on, because lately it has been deviating from the conversation. So let's just go ahead and get started. Dr. C, can you introduce yourself?
Hi everyone. I'm Satya Chilukuri. I'm a practicing internal medicine doctor here in Michigan. I had been in practice over 18 years.
All right. So can you get us started off by telling us about your undergrad journey and how it led you to become an MD?
Well, my undergrad, I come from India. My basic educational training was in India. It is slightly different when compared to here, but one good thing is in India also it is entirely in English. So I didn't have any problem with the transition because it's the same subjects, it's the same content we learned, and English was the medium of communication. So, but here you guys, to get into med school, you do 4 years undergrad. Over there, we go from high school to med school. But here you do 4 years of med school. Over there, we do 5 years of med school and 1 year of, we have to do 1 year of internship. It's a compulsory rotationary internship. You go through all the departments of the, of the medicine, so that you are ready to go into the postgraduate training so that you can pick among your rotation which you would like, and then again go to the postgraduate training. So it's slightly different, but getting into the medical school, it's the same. It's very hard over there also. From where I come, it is very competitive. From the state where I come, usually at that time it's about 30 to 40,000 students who were applying for that medical school. And then we have to take, after high school, we have to take an entrance test. Like you have MCAT here, we have another, back then they used to say MSET. So we used to prepare for the MSET while we were in like 11th and 12th grade, and then we took the exam, and depending upon how you did in the exam, and they used to allot us ranks, and we had about 500 seats in the med schools in the state where I come from, and then if you were in that 500 ranks, you were placed in the med school. Okay. And after you are in the med school, it's the same journey, it's the same subjects what you have, and then we used to do exams, board exams after each. I mean, the entire schooling, like 5 years of schooling, was divided into 3 parts, and at the end of each part we used to give our examinations. But after, once I got done with my med school in India, I came to this country, and then I took a couple of gap years because I wanted to get more familiar with the research in the medical field, and also I wanted to be more familiar with the way they treat the patient over here. I mean, though the science is same, the way we got trained is slightly different. The type of patient population is different. So I kind of did some volunteer work at U of M as well as Wayne State School of Medicine. I did, some research voluntary things, and as well as I did some I observed a lot of doctors, and I used to go on rounds with the residents. So when I was ready to join the residency after taking my USMLEs, again, taking USMLEs was not a great problem for me because mainly because versus different countries in India, we don't have any language barrier when you come here. So It was not that difficult. I was able to finish all my 3 steps: USMLE step 1, step 2, step 3. While I was doing that, I was also doing this research, observation, and so my resume was pretty good, and I got good letter of recommendation from the doctors here. So I got into the I did my residency here in Michigan itself, and after that started working. Once continued to stay in Michigan. I didn't leave Michigan.
Mm-hmm. So, obviously, getting into medical school is very competitive, no matter where you are. So, what advice would you have for students in terms of extracurriculars such as volunteering, shadowing, clubs, internships? What advice do you have? What should students get involved in?
See, one thing is, all those are very important. You need to check all those boxes, but first, be very focused in your academics. Getting a good GPA is very, very important. You can't undermine that. And good preparation for MCAT is, first you have to make sure you do that, and then try to rotate with the doctors or observe the doctors and see which part of the medicine you like it. I mean, you want to be a surgeon or you want to be a medical doctor, and try to do the research or any other work, try to relate everything to the field you want to go. I know sometimes it could be difficult at the age you are, like, to focus and say, hey, do I want to be a surgeon? Do I want to be a medical doctor? Do I want to be a nephrologist? I mean, it's difficult, but the more you observe the doctors doing, and the more you get interested in that, pick things which are all interrelated. You need to do some research. You need to have clinical hours like observationship. All those are important. At the same time, don't overkill it. Try to balance them out. Don't go into 10 different ways, but 2 or 3, and try to concentrate and try to pull them together to your interests. That will make you a better candidate.
Okay. So, when you're pulling everything together and you're pulling all of your activities, everything you've done, um, along with all of this, what are the most important steps a student should take while they're in undergrad to be successful as a future physician? Like, what do you recommend that they see or do or, get involved with outside of just extracurriculars?
Outside of extracurricular, I didn't understand the question.
Um, just like what are the most important steps a student should take overall to see if they would be successful as a physician?
One thing I would certainly say is, look out for the physicians who are willing to help you. I know some schools, some pre-med programs, they do help kids, like MSU. The kids had opportunity to meet with so many DOs and learn their experiences. So that would help you to, develop some interest. You need to be, interested in that, so that you can put your 100%. Putting your 100% is very important. One thing with the medical profession is, this is a lifetime process, and you're learning every day. And I don't want, you to be regretting later, why did I pick this field? You need to be prepared for it. So the more you observe, the more see the doctors going through their day to day. I think that will definitely help you to come to a conclusion. Hey, I need to do this, and staying focused on the task is very, very important. Don't think that I can't do this. No, if you decide to go into the med school, you will go, as long as you're focused and you're hard working towards your goal. But you need to improve every day and reach to that goal. For that, see if in your family or friends, if there are any doctors. If you don't have anybody, go to the nearby medical schools or universities, try to meet with people and tell them that you're willing to do anything, and slowly they will give you more opportunities to participate with them, and that will definitely take you long ways.
Mhm. So, going off of that, why did you pick MD over DO? And can you kind of discuss the differences and similarities between the two?
Hey, let me tell you one thing. In India, we we don't have DOs. It's only MD schools we have. But after coming here, I learned mostly about the DO programs, and I work with a lot of DOs. I know I mean, from what I learned from my DO colleagues is like in the basic training process, it's exactly same. Both are 4-year medical school programs, but DOs have 200 hours extra hours. They teach them some manipulative skills, and mostly it is useful for, I mean, orthopedic skills, sports medicine. I mean, those doctors really like it because that, I mean, when compared to MD, they know more about, I mean, the musculoskeletal parts. So that is the basic difference. But when you come to the clinical practice, both of them are exactly same. I mean, the amount of, I mean, the patients they see is same, the amount of compensation they get is same. Everything is same. And other one more difference, what I learned from, I mean, some of the D was saying is the research opportunities might be little less with the DO programs compared to MD programs. But again, it comes to back to the, the student. If you are interested, you can go and rotate in any university program, even though if you're in a DO program and they are not offering like the, but you're interested, you can go out. You can go out to the other universities in your elective months and do research. So it all depends upon the individual capability and the interest you have in that. Even people who go to the MD programs, I mean, if you're not interested, you're not going to get involved in the research programs. So mostly the research part helps you with the fellowship. If you want to pursue high after residency, you want to go for higher studies, that's called fellowship. The research, the more research you do, will be helpful to get into the fellowship programs and and other academic programs. So you need to, I mean, as you travel through all these phases, you will realize what, I mean, which what interests you, and then you can pursue further. But beyond this, I don't see very, I mean, a lot of difference between MDs and DOs. Both are capable of doing the same things.
Mhm. So, moving on into residency at after medical school, can you talk more about how competitive the matching process is and how the matching process takes place?
Sure. You know, well, I mean, it's been like a little over 20 years that I did my match, but the basic process is same back then and now, because even now there are a lot of foreign medical graduates coming. So I'm going to touch a little bit that, because you're going to be in competition, they will be in competition with you guys too.
Mhm.
So usually, even when I came from India, I did my USMLE step 1, step 2, step 3, and clinical exam, all 4 before applying to the residency. Same thing with the you complete your med school, and but for you guys during this 4 years, USML is step 1, step 2. They're kind of embedded in the program itself. You don't have to waste another year or so to take the, so it will be part of your medical school journey. So after you're done with 4 years, you're already done with your step 1, step 2, and clinical exams. One thing is getting a good score in USMLE step 1, step 2, it's very, very important. For that, what I would advise is putting your 100% when you're doing your coursework during your med school is very, very important. And then, you rotate through hospitals during your clinical years, learning more about the patient care, and be ready for the, that helps in the residency process too. And especially if you want to get into bigger, higher, bigger university programs, you need to have good scores, good research experience, good letter of recommendations, very, very important. And making connections is, I mean, the connections will take you to a higher level programs, versus like not doing it, yeah.
So, I actually like noticed from the comments, and I've read online too that step one and is changing to pass fail in the upcoming years.
Right.
So that will kind of put everyone on this level playing field that everyone's either like, going to pass or fail. So as a student, let's say who like passed, how do I stand out compared to another student who passed? If we're both on the same field, what can I do in med school to attain a more competitive residency? To get a spot over a different individual who might be going for the same spot.
Sure. Still, you have USMLE step two. Still
Mm-hmm.
have USMLE step two, and then you will have to have, I mean, you'll be writing essays, you'll be writing about yourself, about your work you did during the residency, like research or special case studies or some papers you, I mean, all those will help you. So yeah, and good letter of recommendations are very, very important. And the connections with the people over there in the bigger programs is, I know, I mean, it's hard to have connection with, I mean, like all over the country, but if you are a good medical student, definitely all this will build up. You don't have to put extra effort. When, I mean, when you go for your clinical rotations, if you're good with the professor, I mean, the rounding physicians over there, they'll write nice letter of recommendations. And then your elective years, pick some universities you would be interested and try to go and rotate there. That will also help you for to build up your relations. I mean, especially try to know who is the attendings over there, they're good and who are helpful to the kids, and try to take electives with them and try to have a relationship, ongoing relationship with them. That will be definitely helpful in residency. I mean, for me, letter of see, I didn't get I mean, there are some letter of recommendations from India, I didn't use them. I developed it. I mean, I had good letter of recommendations from, I worked in Wayne State University, School of Medicine with infectious diseases doctor. I mean, all those people, they gave me good letter of recommendation that really helped me to get into the residency program. So similarly, you need to figure out what are the areas of interest I have, which universities I like, and try to do the rotations in those universities. And that will be very, very helpful, and that will help to, even for them, when you're applying, if they know you, and so you match them, they will match you, and it will be an easy process. And once you've done all these exams and you're ready with your letter of recommendations, then you apply for your residence.
Mm-hmm.
And then usually, I mean, the 10 spots or whatever, you rank them, they rank you. If you both rank on the same level, I mean, if the university prefers you and you prefer them, then you get matched.
Mm-hmm.
And again, let me tell you, I mentioned once before, there are, I mean, applicants coming from the other countries, and most of them, they really have good USMLE scores, and they are competing with you guys. So you need to have both your step one and step two scores good, as well as this research letter of recommendation, so that you would stand out better than them, and you can get into the program you want to get. You don't want to get compromised in your choices, after going through so much struggle. I want you guys to get into the program of your choice.
Mm-hmm.
And I mean, and that will give you a lot of satisfaction.
Right.
That is,
So
yeah.
obviously, when you came here, you probably didn't have a lot of connections or you didn't have a lot of people you knew. So there's probably other students out there, and I saw a question in the chat that was really relevant to this. But do you have any tips for students who may not have medical backgrounds or friends or family with medical backgrounds on how to make these connections in order to get experience and patient care hours and stuff like that to build a partnership or build connections? How does a student do that if they don't have a background?
Sure. I mean, none of my family members were doctors, or after coming here, I had zero help. What I did back then, I mean, emails and other way of communication was not that popular. So it was over 20 years back. So I went to University of Michigan one day and try to learn, I mean, who are the professors again who are friendly with, I mean, for this kind of opportunities, and I directly approached them.
Mm-hmm.
Once, I mean, once you go and approach, they may not say right away, oh, why we have a spot, come from tomorrow. It doesn't happen that way. Probably for you guys, what I would say, it's easy to get emails. Try to, if it is research opportunity, try to find a university program which has a med school attached to it, or a residency program attached to it, so that it would be helpful for the future also. Whatever you do today, it would be helpful in the future. And then get their emails.
Mm-hmm.
Email them. And as I said, first, day one, they won't say come from tomorrow you started, but you can tell them, I'm willing to do whatever you want, and you start your journey like that. That's how I started. I mean, like, this was in Wayne State School of Medicine. Initially they said, oh, we do not let anybody to come and round with our, I mean, along with our residents seeing the patients. I mean, even today they don't let anybody outsider to come and see the patient. But I started as a, I mean, research volunteer, and later I found out who are the friendly professors, I mean, rounding physicians. I went and approached them, and they let me to round with their students.
Mm-hmm.
And so same thing, you start with this small job, and then go further what you want. So it's your motivation. Unless you are motivated, and you're working towards your goal, nobody will come to you and say, hey, I have this opportunity, come from. No, that will not happen. You have to put your 100% into this. And when you put one step forward, then you will go further. Otherwise you won't go anywhere. So, I mean, depending upon where you are doing your undergrad, see in that university itself what are the opportunities to grow in the medical field. Go approach them. If they are not responding to the email, if you feel that there are some busy doctors over there in the area, go talk with them. I mean, you go, maybe first day they may not meet them, and take a time. They might give you time to come back. Go say, hey, I'm interested in your field, like, I want to learn. I'm pretty sure most of the doctors will say, yes, come, and they will help you out. But you need to have that initiative, that then only it will happen. You need to open your eyes, look around. Even if you have no doctor in your family or in your friends, you can still make connections.
Mm-hmm.
But that you have to go in search of those opportunities.
Okay. So, moving on more into your current life and your work experience right now, could you go more into detail about what your current job looks like as an internal medicine physician, and what a typical day of work looks like?
Sure. Let me explain a little background about the internal medicine jobs, and then I will come, so that it would be a smooth transition for me. As I said, when I got done with my residency, I was not sure whether I want to pursue. I mean, I really wanted to pursue my fellowship, but there were different issues at that time. Like, we had, I mean, visa issues, and for you guys, you don't have to deal with. And I want to have kids, and all these things were going on. So I thought I would, I mean, stop my. I mean, I didn't want to go further with the fellowship. So, as an internal medicine doctor back then, we had three different types of job opportunities. One was like being totally outpatient physician, like you take care of the patients only in the office, and that's it. That was one type of job. The second type of job was, which was again, it was just coming, it was just getting started at that time, was like hospitalist job. What hospitalist job means, you only take care of patients in the hospital. Now it is very popular. When I completed my residency, it was just coming into existence. Now it is very popular. Hospitalist job is very popular. That's one type of. The third type of practice is a traditional internal medicine practice, where you take care of the patient in the clinic as well as in the hospital. And when the first year after I came out of the residency, I chose to be an hospitalist. I did a job for 1 year with a different group of patients, and then I realized that I didn't want to just, I mean, be like just restricted to only inpatient practice. So then I started started my practice, I opened up my own practice. At that time, actually, I was pregnant with my second kid, and I opened up my own practice. When I see the type of practice I wanted to do is I wanted to see the patient in my clinic, as well as when they get sick and get admitted to the hospital, I go take care of them, and they will come back to once they are better, they get discharged, and again they come back to the clinic, and this journey continues until, like, the death. Basically it's a beautiful journey in the sense, you know mm, even today I'm doing the traditional internal medicine practice, and this is something, it is getting lesser and lesser. I think nowadays not too many physicians are, especially newer graduates are not having this opportunity what I had before, because there is some change in the way the government want to do things. So but I still I'm doing by my both outpatient and inpatient practice. When I and I'm affiliated with two different hospitals. So as a part of that affiliation, I take calls from the hospital too. Sometimes they, when I'm on call, I take some unassigned patients, like, sometimes patients with no doctor comes to the hospital and they don't know whom to admit. So when I'm on call, that for particular hospital, they'll call me and I admit the patient, I take care of them. Sometimes they want to come back and follow up with me. Sometimes they go back to their outpatient physician. So I go to two hospitals, and then mostly in the afternoons, I see patients in my office. And it is very satisfying for me, and I like to do this until I retire. I hope, things don't change in a way that they will force me to just stay inpatient or outpatient, because that's how the culture is changing because of lot of different requirements happening. So the most advantage of this type of practice is I know the patient thoroughly. It is very easy to take care of the patient when he's sick, versus, I don't know about the patient, and then I'm picking up them from the call. It's difficult to give or your 100%. At the same time, you get connected with the patient, and when they come to their end of life, the decisions are very easy. You know what the patient wants, what he doesn't want, and then you can help them to die peacefully.
Mhm.
I have, I did so many of those, and I like it. I like doing this way. Do you have any specific questions, like what you want to know, like how my day goes, or um,
So in this, what type of patients do you see? Like, what type of cases do you address as a internal medicine physician?
sure. Typically, internal medicine doctors see age groups from 18 through like 100, whatever, in fact. There is subtle difference. This is internal medicine versus there is another medicine, family medicine. They take care of kids also, but we typically start seeing patients from 18. Some exceptions are there, we do from 16, 17, but mostly 18 through 100. And then the type of the cases we deal with is the common diseases, like, cold, cough, hypertension, diabetes, pneumonias. Preventive care is big. We do physicals and make sure, we don't want them going to become diabetic. We identify who has high risk factors for getting diabetes. We work them. We refer them to for exercises or dietitian, and try to um, prevent them progressing to diabetes.
Mm-hmm.
And then any type of acute sickness we take care of in the office, not like, sutures. So I know there are some doctors who do sutures or everything in the office itself. I do not do that. I take care of only medical aspect. I don't go into the surgical aspect of the medicine. I only do the medicine aspect. And then mostly we do continuity of care, in the sense, like, there are so many chronic illnesses like diabetes, hypertension, congestive heart failure, they are atrial fibrillation. All these need continuous management of the patient. So you see the patient, you bring them back, you monitor their drug levels, you adjust their medications, you do your preventive care screenings, and make sure as an outpatient physician, I make sure that I reduce the hospitalization for that patient. Let's say a sick patient comes, I do everything to prevent the hospitalization. And the insurances love it because I'm trying to keep the cost of care less. I mean, once they go to the hospital, the cost of care is more.
Mhm.
So as an outpatient physician, I'm available for them. I mean, we give very easy appointment. They can come and see me if it's an established patient, so that I make sure that I prevent a hospitalization.
So, while you're working, could you talk more about like how many different providers you interact with in a day? Do you interact with PAs and nurses and NPs? Could you talk more about your relationship as an internal medicine physician with other providers that you work with?
Sure. In internal medicine, any primary care job is a team approach. It's not like you are the only person who are trying to take care of the patient. Like in the hospital, we have a bunch of people who work along with me. Like if let's say I'm on ER call, right there it starts. I mean, I talk with the ER physician calls me. He explains me why this patient needs admission. Then I say yes or no. Okay, let's admit. Then he transfers the call to a different, like a nurse or a physician assistant, and they take orders from me, like what I want things to see. So I'm coordinating care with them. Then from there, the patient goes to the floor. So on the floor, there are nurses and some other PAs. And so I go in the morning, see the patient, talk with the nurse, explain to the nurse like what needs to be done, so that we're taking care of the patient in a timely manner. And again, at every level, the cost of care, I mean, the how much, you know the hospitals want to keep the cost of care low, so that they are profitable, rather than we want to take care of patient on time and discharge patient on the for that. Coordination with other providers is very important. And sometimes I consult a nephrologist or a cardiologist or a gastroenterologist or a surgeon, and I make sure that they're seeing the patient on time, and we are discussing the treatment plans, and we are explaining to the patient. One beauty about the internal medicine doctor is you're a team leader. If you think the other person, even if it is a consultant or somebody who is like who might be educated way above you, but you think that is not right for your patient, you raise your voice and try to do good for the patient, rather than going overboard and letting the other person. So you are the pilot of that plane, and you have to navigate in such a way the patient gets better and comes out of the hospital. Same thing with the outpatient practice. Like a diabetic patient is there, you need for education purposes, you need to send them for diabetic education programs. You need to send them to a dietitian. Sometimes during that process they might develop congestive heart failure or kidney failure. Then you're sending them to a kidney specialist. Then you're coordinating with the kidney specialist, and what you want the other person to do. I mean, what do you want for that? I mean, you need to tell the consultant what you're expecting from this consultation. So there is a lot of interaction, I mean, in my office, I mean, I work with the two MAs, two medical assistants, and they help me to bring the patients. And then I'm talking with them like to give how to give vaccinations, and how to check for, like, we have a checklist like for the preventive care. So it's not one man show, it is a team approach. And it is a very unique and very active hands-on field in internal medicine, and it is very satisfying to do like a primary care job.
Mm-hmm. So, going back to when you said that you own your own practice and you work in a hospital, could you talk about how different your job is in both settings, and also how you came to own your own private practice and what the steps you took to get there were?
Well, we can't separate, like hospital thing is a different job, and office is a different. It's the same thing. I kind of divide my day like morning have, because hospital patients are more sicker. I attend them first. thing in the day, and then I go to my office. I mean, each physician does it in a different way. This is how I do. And most often it could be my practice patient who got admitted, or the patient through the ER. So first I take care of my uh, hospital patient. But as you said, sometimes it can be challenging. While you are in the hospital, you get calls from your office like, hey, this patient is here, what do you want me to do? It can some, I mean, some days could be like that, but a good doctor will manage it, because now, I mean, even in your sleep you can treat a patient. I mean, that's how the life becomes, and once you're confident in what you're doing. And these are not like two different entities, so it can be hectic at times, but you can balance it out. You can balance it out, and it's a smooth transition. I mean, it's the same medicine you're practicing both. So I never felt difficult, though I felt hectic sometimes, but overall at the end of the day, it's satisfying for me to do that way. But for you guys, I don't think you will have that opportunity. I think somebody who wants to be in primary care, going further, they are forced to pick whether they want to be just doing outpatient or inpatient. Yeah, I don't think this type of opportunities going forward will be available or not. I'm not sure. And then coming to how did I set up my own practice? I started taking calls. As I said, there are some unassigned patients who come through the hospital, and whoever the internal medicine doctor on call, they assign them to you, but not necessarily they come, all of them come and follow up with you in the office. That's one type of acquisition of the patients, but most often it's patient referrals. Like let's say you have a patient today. If the patient likes, the patient brings you, I mean, her family members. So I get some patients like that, and I'm enrolled with so many insurances. So insurances also send refer patients to you. So over years, the practice builds up. And also, though I started off from scratch in the beginning, at some point I acquired a different physician practice. So it was kind of a jump start. I acquired his patient. So it was a jump start from me. And it goes on. It's insurance referrals, patient referrals, hospital referrals. Over the years, you will build the base. Yeah.
So before we move on to questions, can you talk about what the most challenging and rewarding aspect of internal medicine are?
You know, one thing is I love doing primary care. The best part is, as I said, we will have a good relationship with the patient. Now with the changing things, what the most challenging thing I see is dealing with the families, because now all the information is available. I mean, you search for something on Google, and Google doctor gives you like zillion options. So nowadays, I think the biggest frustration most of the physicians are facing is, half knowledge patients come, and not just the patient families get involved when they get sick, and then satisfying them it's a challenge. You have to satisfy them. At the same time, you have to do what is appropriate for the patient. You're not going to, you need to practice evidence-based medicine. You cannot do what patient is asking you to do. There are so many patient families who are pushing, and then and they want the loved ones to be living forever. That's not going to happen. But to convince them to withdraw the support, it's a challenge. And then to explain them why we are doing this, not everybody will get convinced. So that is one of the, biggest challenge. A lot of physicians are unrealistic expectations from patient and patient families is a biggest thing. But again, the most rewarding thing is if you're in the practice for a long time and this patient is coming to you over the years, that can be overcome. They know you and you know them. And then in my experience, in the last 18 years, there's some patients who are following with me, and when their end comes, and then I know when to withdraw their care and offer the families, telling them, put them in hospice or will just do comfort care, and they die very peacefully. and they come and thank me. I mean, that's the most rewarding, not only treating them when they're well, I mean, like the preventive aspect, you're treating them when they're sick, and when they're ready to die, they have to die with dignity. As
Mm-hmm.
a primary care physician, like the traditional primary care physician, I got to do all those, and it was, I mean, I really like that part of the medicine very much. you know One thing is, don't focus on the money aspect of the medicine, but focus on compassion. I mean, you be very compassionate and love what you do, and you will enjoy every part of your journey. And one thing I will tell everybody, if you are really interested in medical field, don't lose your heart. If you are not really making progress, put your 100% into that. You will get there. You need to be very focused and very hardworking. This is some hardworking part will continue throughout your journey. But be focused, and you will get there.
Okay. So, moving into some questions I saw, um, someone asked, how important is research as a medical student compared to research in undergrad?
Um, if I think it is important to be exposed to research right from the high school level. You need to know basics of the research. If you want to just start it when you're in residency, you're not going to achieve a lot. If you start early, and you need to know your basics, so that when you go to your undergrad level, you can show them your experience, your previous experience, so it's very easy to get good research opportunities. Same thing when you go to your residence and you already did in your undergrad, you will go to the next level of research, and that aspect will help you even further getting into your fellowship of your choice. And it is very, very important to get exposed to the research basics in the high school itself. But if you didn't do in your high school, that's fine. Now you guys are in undergrad, go out, reach out to people, start at some level, and go step by step.
Okay. So, could you talk more about what the difference between a family medicine physician and an internal medicine physician is? I saw a couple of people ask that.
Sure. Hey, a medicine doctor is, internal medicine people only take care of, as I said, from 18 through 100. I mean, 100 or whatever the end, end of the life is. Family practice, they get to rotate in like pediatrics, OB, I mean, little bit of all the medical fields. So in a way, they are also primary care physician. They take care of some pediatric population also. They take care of pregnant people. Some people, I mean, some doctors do deliveries also. Um, uh, some of the family practice physicians, they chose to be just like pediatricians, and then just, I mean, they restrict their practice only to the kids. Or some, I know some wanted to restrict their practice to OB, and they just do OB practice. So that is one advantage with the family medicine. But one, I mean, advantage or disadvantage, I don't know, but like you want to do internal medicine subspecialty fellowships like nephrology, cardiology, those opportunities are not there for family practice doctors. Only those opportunities are there for internal medicine. If you are if you have an idea that you want to pursue one of the medicine subspecialties, then going into the internal medicine program is better than going into a family practice. But if you want to just do the primary care, either of them is fine.
Mm-hmm.
Either of them is fine. Somewhat, if you say for just outpatient primary care practice, family medicine might be better than internal medicine, because you're seeing wide range of, you can include the pediatric age group also. So
Mm-hmm.
yes. Yeah.
And then one final one before you move into in depth about primary care. I saw someone ask information on how you would make your personal statement and what type of things should be in there.
you know One thing regarding the personal statement, you you as I said in the beginning, you need to have your story, how the things you did all through these years, how you're able to connect to the program you're applying. Like let's say internal medicine is, I mean, I'm just going to give the example of the internal medicine. Let's say, you, I mean, diabetes or hypertension. I mean, just take an example. I mean, try to do things which are related to diabetes and try to present in a story way. And I mean, not like just like, theoretical way, but how you got, I mean, how you could connect everything. Like you did something with the diet. I mean, maybe you volunteered in with a dietitian, and maybe, you developed some nutritional value things, or you did some research in the diabetes, and how you were rotating with an endocrinologist or an internal medicine doctor who, and try to get that in a story form.
Okay.
And why did that particular program you're applying interest you? Or maybe this is strong in primary care, or this is strong in diabetic care. So I mean, try to, I mean, connect everything and present it. That would be more attractive for the person who is reading it.
Mm-hmm. So, unfortunately, we can't answer all the questions, guys, because we do have a time limit. But now Dr. C will talk more into depth about primary care in terms of diagnosis, importance of primary care, and the role of a primary care doctor. So could you go more into depth about your specific field?
Sure. I'll give you two scenarios, like, I mean, typically a primary care person does versus, I mean, this is not something a specialist does. And I would tell you why it is important. First, I will stress on the preventive care. Um, I will, during physicals, I know when you kids go to the, I mean, it's not nothing much is there. I mean, the doctor to talk except for the drugs and, sexual behavior. But when an older person goes, we offer screenings like, cervical cancer screening, we offer breast cancer screening, and there were and colon cancer screenings, prostate cancer screen. This is very important because this is only done by the primary care physician. This is not done by any specialist. I know some people don't believe in primary care, but they are losing that opportunity to find out the disease earlier. But not only cancer, if you go for the yearly physicals and you get your lab work done, I can see, I mean, this patient is high risk for diabetes, and then I counsel them, and that would prevent them going into diabetes. So you're, I mean, for insurance aspect, you're saving a lot of money for them, preventing a disease for the patient. For the patient, you're saving so much of morbidity and mortality. I mean, for colon cancer screening, we send them to a colonoscopy, and during colonoscopy, they visualize their bowel wall completely, and if there are any suspicious polyps or some lesions, they take them out. So, if you don't do the colonoscopy, that guy will go into colon cancer, and the amount of morbidity and mortality attached to the treatment is so high. So you're preventing. So this is the beauty of the primary care. I know a lot of kids, I mean, they're shying away from primary care, but guys, it is such an interesting field. You will have strong relationship with patient and patient families, and the amount of satisfaction you would have preventing a cancer, or recognizing a cancer at an early stage and offering treatment is like, it's so rewarding. That's in regards to the, preventive care. Now, if you, acute sickness, I will explain how, if you go to your regular primary care physician versus going to an urgent care. I'll tell you, I've never, I always tell my patients, call me or come to the office, because I know you better, and I can pinpoint the diagnosis better than going to the urgent care. See, a cough can be like zillion different reasons for the cough. Let's say you go to a physician whom you have your established care with them versus to the urgent care. I mean, this could be a 50-year-old or 60-year-old with multiple problems. Mostly those are the complex patients you are dealing in the internal medicine practice. I mean, I see mostly geriatric for most of the, those are the people who have a lot of diseases, right? I mean, rest of them just come for the preventive care and maybe once a year, once other year. But most, I mean, a bulk of my practice is like, from 60 to 100. My oldest patient is 99, and I had a couple of patients who, I mean, who were 101 and then they died. So that's my, so it's, let's say they come with cough. Cough can be simple virus, like cough can be congestive heart failure, cough can be asthma, cough can be like gastric reflux. If you know the patient's history, you can pinpoint diagnosis just like, and talking with the patient, examining the patient, knowing the patient, you can come to the diagnosis and give them what is needed, versus you go to the urgent care, they do zillion tests. I don't even do, I know exactly, I mean, I only do the test when it is needed. I know this patient, so it is very easy for me to come, I mean, formulate a differential diagnosis, come to a conclusion and treat him, and I know what medications he's taking because I have the whole list, and I make sure there are no interactions, explain to the patient and give, versus going to an urgent care. I mean, this guy, I mean, he doesn't know, I mean, they don't have time, you don't take good history, you do, I mean, all these labs, all these x-rays, you don't even see what it is. And instead of giving one, they try to give 4 or 5 different things because they want the patient to get better and have a good satisfaction from them, so that they get good reviews. But the patient is subjected to unnecessary medications and extra cost. A good primary care physician will control the cost, will gain the confidence of the patient, and in the end the patient gets better fast, and he will have good satisfaction and you will have the good. This is not there for any specialty. Let's say if the patient goes to a nephrologist or a cardiac, they are so focused only on that organ because that's what they're supposed to do. But if the symptom is kind of a broad one like cough, it needs to be looked in different ways before I narrow my thing. Still, I can send to the cardiologist if I think I cannot control this congestive heart failure. But you see how it is interlinked. We need more primary care physicians. Otherwise, I mean, there would be a lot of, Medicare dollars wasted in all this, investigations, and a lot of suffering from the patient. Unless most of, the kids, the next generation of kids go into this primary care, we're going to lose the field. We're going to lose the field. We want more young blood to come into this field.
That's important too, because you guys are all preventative and we want to take care of the problem before it.
Right.
So is there anything else you'd like to add in terms of primary care, or any advice for students, or just overall, just to kind of wrap it up?
Well, as I mentioned before, if you decided that you want to pursue medical field, be focused, be persistent in your efforts. Put your 100% hard work. You will get there. Don't get disheartened. It is not, I mean, you seen me. I mean, I came from a different country. I have no doctors. Still, I made it like, 20, almost, it's 18 years into my, anybody can do it as long as you're focused and hardworking. And, it's not impossible. People, you talk with 100 different people, everybody try to discourage, talk. Once you decide, don't try to open up these discussions because you're not going to go anywhere. And I have seen people dropping out from the program. I mean, that's not needed if you think you're already focused that you're going to go into medical field.
That's awesome. Thank you for that.
If you guys have any more specific questions, you can just Instagram DM me at Lasia Marla, and I can give them to her if your question didn't get answered within the call and you have some more questions.
All right. I'll actually post your Instagram handle on, I'll actually send it in the chat at lasia.marla.
Just at Lasia Marla. No dot. LASYAMARLA.
Okay, so that everyone on the YouTube live can hear that too. Okay, thank you so much, Dr. C, for speaking to us and giving us all this wonderful insight for anyone who might be interested in primary care, which all of you guys should be now after that important message. So I'm going to talk a little bit more about tomorrow. So tomorrow we do have a call with Dr. Angel Leitner. She is a DO and an OBGYN. She's a PGY4. So this was more of an informational call, and we do realize that this is very important for you guys to learn about different fields and the backgrounds that go into these fields. And that was the whole focus of our Zooming through summer segment. We just wanted to announce that we will be continuing this into fall as call through fall. And in that segment, we will be shifting over to a more case study with based focus with more explanation with instruments and perhaps even videos and more specific cases as opposed to a background. But these are very important calls. So as you guys need to be informed about what goes into becoming a doctor and what the real responsibilities of becoming a doctor are. So if you want to hear more about background, please check out our previous videos that we have recorded with doctors. And so tomorrow we have a call with Dr. Angel, and she will be going over her background as well, and she will be presenting a case study. So there's that. And then just to wrap it all up, guys, we please ask that you donate so we can keep this program running for free. We love helping you guys, but it is very pricey to run these. So here's our information. Our Cash App is Club Med Shoe, same for Venmo, and there's our Zelle. We please ask that you donate even $1 because it can go a long way. So thank you again, Dr. C, for all the information. We really appreciate everything that you just told us. And remember to come back tomorrow, guys, so you can listen to Dr. Leitner and get more insight on the OBGYN field. All right, thank you. Bye, everyone.